What if I told you that the thing most diabetes fear less is actually the thing that could kill them in next 30 minutes? I tell you that high blood sugar is dangerous. Yes, it is. It causes heart disease, kidney failure, blindness, nerve damage. We have all heard those horror stories before. But here is what they don't always emphasize enough. Low blood sugar can literally kill you while you are sleeping tonight. No warning, no second chance, just gone. I know what you are thinking. Wait. It is not diabetes, about having too much sugar in your blood. Yes, but the medications and the insulin we use to control it, they can push you in the opposite direction. And that's where the real danger lies. In the time it takes you to watch this video, in 15 to 20 minutes, someone with a severe low blood sugar could go from feeling perfectly fine to having seizure, falling into coma or worse. That is not an exaggeration, that's medical reality. Meanwhile, someone with the high blood sugar, they are uncomfortable. Sure, they are doing damage to their body, absolutely. But they are still conscious, still able to think, still able to get help. So in this video, I am going to show you exactly what happens in your body when blood sugar drops too low. We are talking about the hormones that flood your system in panic mode. Why your brain starts shutting down in stages. The terrifying conditions called hypoglycemia, unawareness. And why some people literally don't wake up in the morning. Now, before we dive in, let me be crystal clear. I am not saying high blood sugar doesn't matter. It absolutely does. If you have diabetes, you need to control both. The fastest killer is hypoglycemia. So stick with me for the next 15 minutes because this information could literally save your life or the life of someone you love. And trust me, by the end of this video, you will never look at blood sugar at the same way again. Let us get into the topic. Now, I want to be clear from the start. Both conditions are serious, hyperglycemia and hypoglycemia, and need to be managed properly. If you have diabetes, you need to control your blood sugar in both directions. But when we talk about immediate life-threatening danger, low blood sugar, which we call hypoglycemia, is a more dangerous emergency. Think of it this way. Your body can survive with a high blood sugar for hours, days, sometimes in months, even weeks. Although it is damaging, but with severely low blood sugar, your brain could be in serious trouble within minutes. So what happens in your body during both conditions? What hormones get involved? And why your brain is so vulnerable when your blood sugar drops too low? So, understanding the basics of hypoglycemia. First, let us understand what we are talking about. Blood sugar or blood glucose. This is a fuel that powers your body, especially your brain. Normal blood sugar levels around 70 to 100 milligram per deciliter. When you are fasting, and up to around 140 milligram per deciliter after eating. Your body works really hard to keep blood sugar in this range. Hyperglycemia means high blood sugar, usually defined as anything above 180-200 milligram per deciliter consistently. Hypoglycemia means low blood sugar, generally below 70. Even severe hypoglycemia means below 54 milligram per deciliter. Now here is the key thing is to understand. Your brain is an incredibly hungry organ. It uses about 20% of your whole body energy, even though it is only about 2% of your body weight. And unlike your muscles or liver, your brain cannot store glucose. It needs constant supply from your bloodstream by glucose. Your muscles can switch to burning fat when glucose is low. Your heart can use fat for energy, but your brain It's almost entirely depend on glucose only. No glucose means no brain function. That is very simple. Hyperglycemia slowly will damage your organs. Let us start with high blood sugar. What actually happens when your high blood sugar goes up and stays there for a long time? Immediate effects, first a few hours. When blood sugar rises above normal, your pancreas releases insulin. Insulin is like a key that unlocks your cells, so glucose can get inside and be used for energy. But in type 2 diabetes, your cells become resistant to insulin. In type 1 diabetes, you don't make enough insulin. So the sugar stays in your bloodstream continuously. In short term, you might feel thirsty. Your body is trying to flush out the excess sugar through urine. That is the reason you feel thirsty. Frequent urination because of excess of sugar eliminating through urine. Tired and sluggish. Blurry vision. Headache. In hormonal response, with respect to hyperglycemia, your body tries to compensate. Your pancreas keeps pumping out more insulin if it can. Your kidneys works overtime to filter out excess glucose through urine. That's why you pee so much. The stress hormones, cortisol and growth hormones might also rise, which unfortunately can make blood sugar even higher. It becomes a bit of vicious circle. What happens over days to weeks? If hyperglycemia continues for days or weeks, more serious complications may develop slowly. Your blood vessel get damaged, endothelial dysfunction. The damage the delicate lining of your blood vessels, leading to atherosclerosis, inflammation, endothelial dysfunction, hardening of the arteries. Glucose damages nerve fibers and feet and hands. Several mechanisms are involved. Sugar gets converted into harmful substances like sorbitol, which builds up in the nerves. Kidney damage. Your kidneys are filtering all the extra glucose, and over time, this damages the tiny filtering units called nephrons. Eye damage. The small blood vessels in your retina get damaged, leading to diabetic retinopathy. Increased infection risk. High glucose impairs your immune system. Bacteria and fungi actually love sugar-rich environment. That is the reason diabetic people, they may develop recurrent urinary infection, chest infection. The dangerous extreme diabetic ketoacidosis. In severe cases, particularly in type 1 diabetes, very high blood sugar can lead to diabetic ketoacidosis. This happens when, without enough insulin, your cells are starving despite all the glucose in your blood. Your body starts breaking down fat for energy instead. This produces ketones as byproducts. Ketones make your blood acidic. This can lead to coma and death if untreated in time. And this is important, but DKA, diabetic ketosis, typically develops over 24 hours or more. It is serious, but you have time to recognize symptoms and get help. But in case of hypoglycemia, that's not. You may develop suddenly, within hours you may go into coma, become unconscious. Let us talk about low blood sugar, hypoglycemia. This is where things get scary, and they get scary fast. The immediate crisis, minutes to hours, when your blood sugar drops below 70 milligram per deciliter, your body goes into emergency mode. And I mean emergency, literally emergency. Remember, when blood sugar drops, your brain starts to literally starve. And it happens fast. The counter-regulatory hormone response for hypoglycemia. Your body has emergency response system for low blood sugar and is more powerful. Within minutes, several hormone surges, particularly glucagon, the first responder. It is released by your pancreas within minutes when the sugar goes down. And it tells your liver, release stored glucose now, right now, immediately. Your liver breaks down its glucose storage. glycogen and dumps into your bloodstream. Epinephrine, norepinephrine, the alarm system, adrenaline alarm system, released by your adrenal glands. This is your fight or flight hormone and it tells your liver to release glucose immediately. This causes classic symptoms of sweating, shaking, rapid heartbeat, anxiety. But no need to worry about this symptom. These are all defensive symptoms. It's the protective symptoms. They are your body's alarming system saying eat something immediately. Next, cortisol is a backup generator for glucose production. The cortisol released within 30 to 60 minutes. It promotes breakdown of protein and fat to make new glucose. Reduces glucose uptake by muscles, so more glucose is available for the brain. The next, growth hormone, how it helps to counteract hypoglycemia. Also released to help maintain blood sugar. Reduces glucose used by muscles. The physiological stage of hypoglycemia, stage 1. Mild hypoglycemia, 60 to 70 milligram per deciliter. Your hormonal alarms goes off. You feel shaky, trembling, sweaty, often cold sweat, hungry, sometimes intensely, anxious, irritable, fast heartbeat, pale skin. So your brain is still functioning, but it is signaling distress. Stage 2, moderate hypoglycemia, between 40 to 60 milligram per deciliter. Your brain is starting to struggle. You might experience confusion and difficulty concentrating, blurred or double vision, slurred speech, difficulty in walking or clumsiness, weakness or fatigue, headache, personality changes. You might become combative or appear drunk. At this stage, you might not be able to help yourself. You might not recognize you are having problem. Stage 3, severe hypoglycemia, that is below 40 milligram per deciliter, where brain is in critical failure. This can include seizures, loss of consciousness, inability to eat or drink, coma. Sometimes, rarely, it can lead to death if it is not treated for a long time. Here is a terrifying part. It can go from stage 1 to stage 3 in less than an hour, sometimes much faster. What is happening in your brain? Let me explain the pathology. What's actually happening in your brain cells when the glucose goes down? Hypoglycemia. Your brain cells, neurons, needs glucose to produce ATP, which is cellular energy. Without glucose, energy production stops. Your neurons cannot make enough ATP, adenosine triphosphate. Ion pumps fails. Number 2. Your cells need energy to maintain the right balance of sodium and potassium. When energy fails, this balance collapses. Neurons become overexcited. The electrical activity in your brain becomes chaotic. This can cause confusion, seizure, and cellular swelling, neuron cells swelling, edema. Without proper ion balance, water floods into cells, causing them to swell. That is called cerebral edema and cell death. If glucose is not restored, neurons start to die without food. For neuron cells, sugar, glucose is here, food. And unlike skin cells or liver cells, neuron cells don't regenerate well. Different parts of your brain cells are affected in sequence. Cerebral cortex, particularly that is useful for thinking, decision making, goes first. That's why you get confused and cannot think straight. Hypothalamus, hormone regulation, affects your body's emergency response. Brainstem, basic life functions. When this is affected, you are in serious danger of death. The terrifying reality of hypoglycemia is unawareness, unable to recognize the symptoms. Here is something even scarier. If you have repeated episodes of low blood sugar, your body can stop giving you warning symptoms. This is called hypoglycemia unawareness. Your body alarm system gets worn out. The adrenaline response becomes blunted. So you might go from feeling fine to suddenly having seizure or passing out with no warning periods where you felt shaky or sweaty. This is why recurrent hypoglycemia is so dangerous. You lose your early warning systems. Why hypoglycemia is more immediately dangerous? As I said before, hyperglycemia, it may take days and weeks to cause damages. But hypoglycemia is more dangerous, immediate dangerous. Hypoglycemia develops over hours to days. DKA, diabetic ketoacidosis, takes 24 hours to develop. You have time to notice symptoms, check your blood sugar and get help. But in case of hypoglycemia, it can progress to unconsciousness or seizures within 30 to 60 minutes or less than that. You might have 15 minutes window to treat yourself before you can't function. Brain damage is potential in hypoglycemia. Hypoglycemia causes damage over time. Hyperglycemia causes damage over time, weeks, months, sometimes years. Blood vessel damage, nerve damage, kidney damage, these are all cumulative of hyperglycemia. They are serious but gradual. But in case of hypoglycemia, can cause permanent brain damage in a single episode. If severe and prolonged, even 30 to 60 minutes of severe hypoglycemia can kill the brain cells permanently. Children are especially vulnerable to brain damage from hypoglycemia. Immediate mortality risk, hyperglycemia. Death from acute hyperglycemia like DKA usually takes hours to days and is often preventable with IV fluids and insulin. But in hypoglycemia can cause death within hours through seizures, cardiac arrhythmias triggered by adrenaline surge, catecholamines induced ventricular tachycardia. Hypoglycemia combination can stop the heart immediately. Accidents, if you are driving, operating machinery, you may develop. Aspiration, choking on vomiting while unconsciousness. Simply prolonged brain glucose deprivation. The ability to self-rescue. How one can rescue from hyperglycemia or hypoglycemia. In hyperglycemia, you remain conscious and you can recognize symptoms. You can take insulin, drink water and seek medical help. But in hypoglycemia, once you reach moderate to severe hypoglycemia, you lose the ability to help yourself. Your judgment is impaired. You might not recognize the problem and you might be unconscious. You become dependent on others. There is a tragic phenomenon in type 1 diabetes called dead in bed syndrome. Otherwise, healthy young people with diabetes found dead in bed with no apparent cause. Your blood sugar drops dangerously low. You don't wake up because you are asleep and you don't feel the symptoms. You might have hypoglycemia unawareness. The hormonal response that should wake you blunted. In prolonged hypoglycemia, the hormonal response alert system will fail. The hypoglycemia triggers a fatal cardiac arrhythmia and you will never wake up. This doesn't happen with the hyperglycemia. High blood sugar doesn't kill you silently in your sleep. Recent research shows that recurrent severe hypoglycemia is associated with cognitive dysfunction, cognitive decline, increased dementia risk, reduced quality of life, fear and anxiety about future episodes. Even if each episode doesn't cause obvious brain damage, the cumulative effect can be significant. That is the reason Hypoglycemia is a killer, but hyperglycemia is not a killer. Why we still care about hyperglycemia? Now, I want to be absolutely clear. I am not saying hyperglycemia doesn't matter. It absolutely does. Chronic hyperglycemia is a cause of most long-term diabetic complications. As you know well, long-time uncontrolled diabetes can cause heart disease, coronary disease, acute myocardial infarction, stroke, brain stroke, kidney failure, recurring dialysis. Then eventually patient may go into kidney transplantation, blindness, amputation from nerve damage and poor circulation, increased infection risk. These complications severely impact quality of life and longevity. The point is about immediate danger versus long-term damage. Hyperglycemia is smoking. It causes serious harm over time, but you won't drop dead in the next hour. Hypoglycemia is like a car crash. It can kill seriously harm to you right now in the next 30 minutes. But both are dangerous. Both need to be managed. But if you are talking about which one can kill you fastest way, hypoglycemia wins. The clinical dilemma. This creates a real challenges in diabetes management. Doctors want to keep blood sugar as close to normal as possible to prevent long-term complications. But aggressive blood sugar control increases the risk of hypoglycemia. That's why modern diabetes management, patient education about recognizing and treating low blood sugar. It's a constant balancing act. Let us wrap up this with the key points. Your brain is glucose dependent, unlike other organs. Your brain cannot function without glucose. No backup fuel, no storage for the brain. This makes hypoglycemia uniquely dangerous. Speed matters. Hyperglycemia harms over time. Hypoglycemia can harm or kill within minutes or 2 hours. Warning systems fail repeatedly in hypoglycemia. Hypoglycemia can eliminate warning symptoms, warning mechanisms, making it even more dangerous. You lose control. Severe hypoglycemia takes away your ability to help yourself. You become dependent on others recognizing the problem. Brain damage is possible when single episode of severe prolonged hypoglycemia can cause permanent brain damage. Both requires management. This is not an excuse to ignore hyperglycemia. Both conditions require careful attention and management. But practically, if you have diabetes or care for someone who does, take care of hypoglycemia. Practical advice. If you have diabetes or care for someone who does, always carry fast-acting sugar like glucose tablet, juices, candy, chocolates. Wear medical ID jewelry. Check blood sugar before driving or operating machinery. Consider a continuous glucose monitoring. Educate family and friends on how to recognize and treat hypoglycemia. Know how to use emergency glucagon. Never skip meals if you are on insulin or sulfonylureas. Be extra careful with alcohol, which can mask symptoms and prevent your liver from releasing glucose. The final thought, understanding why hypoglycemia is more immediately dangerous doesn't minimize the importance of controlling hyperglycemia. It is about respecting both dangers and managing diabetes with wisdom. So, there you have it. Now you understand why that 3 a.m. low sugar episode is scarier than a day of running high. You understand why your endocrinologist gets more worried about your lows than your highs. And hopefully you understand why that glucose meter reading below 70 deserves immediate respect. Here, what I want to do right now, if you have diabetes, take a picture of this checklist. Do you have glucose tablet in your bag, car or bedside table? Does your family know the sign of low blood sugar? Do you have emergency glucagon? And does someone know how to use it? Are you wearing medical ID? If you answered no to any of this, fix that this week, not next month. This week, if someone you love has diabetes, send them this video right now. Then ask them, do you have anything you need if your blood sugar drops too low? Have the conversation. It might feel awkward, but it could save their life. It tells YouTube to share this with more people who need to see it. Subscribe this to the channel. I break down complex medical topics into simple, actionable information that can actually help you. Drop me a comment below telling me, are you dealing with diabetes yourself? Did you know hypoglycemia was this dangerous? Drop me a comment below telling me, are you dealing with diabetes yourself? Did you know hypoglycemia was this dangerous? What's your biggest struggle with managing blood sugar? I read every single comment and your experience helped me create better content for everyone. And here is the thing, this channel is becoming a community of people who want to understand their health, not just to blindly follow doctors' orders. We ask questions, we dig deep, we empower ourselves with knowledge. So welcome to the community. You are not alone in this journey. We are together. Remember, knowledge is power, but only if you use it. So take what you learned today and put it into action. Check your supplies, have the conversations, protect yourself or protect someone you love. Your brain is counting on you, literally. Thanks for watching this video. Thanks for learning and thanks for taking your health seriously. Stay safe out there and I will see you in the next video. Thank you. Bye bye.